Well, what I really summarized was trying to talk about what is important for older cancer survivors in terms of their quality of life. And sometimes it isn't necessarily just extending their life, but it's really making sure that they're able to maintain their independence. And what we really mean is that they're able to be physically independent, cognitively independent, and kind of maintain their social functioning. So we think exercise might be a way to help preserve independence for older people with cancer, because cancer really kind of threatens their independence and their ability to age well in place and stay in their homes. And exercise might be able to both improve physical functioning as well as kind of emotional functioning and give people a sense of purpose. So I think some of the most important things to keep in mind are that we have to understand what is important for an older adult with cancer. It might differ from a younger person with cancer, and really specifically we want to do all that we can to maintain an older cancer survivor's independent physical and cognitive functioning. I think exercise might play a key role in that, so keeping older cancer survivors as active as possible, doing as much movement as they can and not being sedentary. And if they're able to engage in kind of even more physical activity and exercise, it's going to help preserve their independence and quality of life longer. I think it's really important to understand that exercise plays a role in managing symptoms and side effects from the time treatment starts. So the more active that someone can stay, the better their symptoms are managed, the less their side effects, and potentially then they could even tolerate more treatment. So it's so important in the nursing environment to be able to encourage patients to keep as physically active as possible. But even kind of throughout the rest of their treatment, and when their treatment's over, that staying active is potentially going to help reduce the risk of cancer recurrence. It's going to keep them kind of independently functioning, because if it's not cancer, it might be something else, and exercise really kind of plays a role in that. And I think it's also important to keep in mind that it can be helpful from an emotional standpoint. So it helps reduce anxiety, can reduce depressive symptoms, keep people socially connected if they're able to exercise with other people. Yeah, well, I think a really important role that nurses can have is just encouraging people to stay active and avoid being sedentary. So those two things alone, it doesn't even have to be prescribed exercise, because that can be off-putting for people or it can feel really intimidating. But finding ways to keep people from being sedentary, even taking short breaks. If they're sitting and watching TV or they're sitting and reading, can they get up and stand? Can they do short walks? And I think it's important to emphasize that, I believe we're going to find that even light intensity physical activity, so that's kind of an intensity of exercise where someone could sing while they're doing the movement, that is beneficial, maybe not more so than more moderate or vigorous exercise, but it can still have significant benefits. So that really expands the types of activities that nurses can recommend. It's not just necessarily going out to a group exercise class or getting to a facility or a gym and using machines, but gentle yoga or restorative yoga classes, tai chi chuan, golfing, leisurely walking. These are all more accessible types of activities that people can do, even if they're not very physically active already, even if they've got some symptoms that are bothering them, that short amounts of physical activity that keeps them kind of below the point at which their symptoms are being provoked or exaggerated, or even for shorter bouts, that can be effective. And I think that can also start to change behavior. As people get older, and then when they get a chronic illness, they can get more and more socially isolated, right, and experience feelings of loneliness, and that can certainly impact their health. And I think being able to use exercise potentially or physical activity as a mechanism to get people together and to keep them connected with other people doing something positive and healthy can only have kind of multitudes of impact and give them this sense of purpose.